Namaste to all. I am a family physician, family doctor. You rarely find a family physician nowadays sitting on table. So thank you, International Patient Union. And before I proceed, I just give you a food of thought. In any part of the world, do we ever call a group of doctors super specialists? In any country of the world, do we call any hospital super specialty hospital? Any country except India. And you'll see how our system is designed. So when we talk of patient-centric care or person-centered care, what is the intent of the entire sum total of the system? What is the objective of the entire sum total of the health system that we are talking of today? Is it for the benefit of the patient? It is for the positive outcome, public health outcomes of the patient? What is the objective of the private health system, for example, we have been criticizing since morning? What is the objective or intent of private healthcare institutions in this country? So we have to think about it. I'm a private practitioner. I practice in outskirts of Delhi, and my employees are my patients. I'm not employed by government. I'm not employed by any insurance company. I'm not employed by any corporate. So my interest is to protect interest of my patient and the community that I serve. Whatever community I'm serving, and they are sufficiently rewarding me financially, although in today's time, they say that it's a concept of past family physicians, but I'm surviving in the middle of large corporate hospitals because no one else is doing that. Everybody wanting to become Dr. Trehan, Dr. Sareen in context of medical education. And the career pathway of medical doctors is designed in a way that you have to keep on moving from basic to specialist to a super specialist that we only find in India. And as we see from the system design perspective, in the government public health systems, patient care is under diagnosis. I've been recently visiting a public health system hospital of reasonable size, and the common prescription, almost 90% of the prescription, diclofenac, paracetamol, CPM, metronidazole, iron, that's all diseases. Anything, pain, abdomen, fever, malaria, cholera, whatever you come, you'll get a diclofenac. So this is under diagnosis situation, and we drive patients from there into a system which is depending or which is striving or which is functioning on over-diagnosis that we criticize for being profit-making private system where we want to make more money on every opportunity. I recently got a call from a mother for a deep cut on chin of her daughter. I said that I'm busy in my private clinic. I will not be able to do stitches. Please go to the nearby corporate hospital. And they were asked 30,000 rupees in insurance and 60,000 rupees for a chin cut by a plastic surgeon. And they came back to me, sir, please do something. So I arranged to do it at the emergency of a small nursing home for 2,000 rupees. I'm talking of suburbs of Delhi. So this can be the asymmetry of price of a procedure which can be done for 2,000 rupees. Same would be charged 60,000 rupees. So treatment for diarrhea, cholera, dengue, bypass is all same in corporate hospital. So I have to talk in terms of professional autonomy also. As I said, if a professional is very, very good, skilled, competent, but if still working for some employer, is not professionally autonomous. We talk about professionalism, we put this in medical curriculum, medical ethics, but if the system is not ethical, if the system is not in the interest of the patient, then it is very difficult for a professional doctor professional to function ethically or what we call in the interest of the patient. Another thing I would, lastly, towards the end of my things, is patient safety and standard of care. Safety is very, very important. And in general, we have a very callous attitude towards safety. I'll give you an example of Prince syndrome. Prince, the child who fell into a deep trench, and he was evacuated by Indian Army. And if every month you will keep on listening to this, news. Even yesterday or day before yesterday, some boy fell into a deep pit, and he was being evacuated, and this being nationally televised all over India. And we keep on taking this as a normal thing. and same attitude across all domains of governance of our society. We have, lack of interest or, concern about safety. And this safety things will come only with high quality. And the poor quality care comes in the health system when we don't have any control or, interest in controlling poor quality care. We quacks very easily, quacks, I mean all types of quacks, Bengali Babas, for Chinta Haran, Swatan se Chutkara, Mirgi se Chutkara, Videsh Yatra, Naukri se Dukh Haran. These kind of advertisements are published in national newspapers, open to all. So if we cannot ban this kind of practices also, leave about the, non-trained practitioners or professionals, it is very difficult to talk about safety and safety in terms of very high-end hospitals. And lastly, we require an interface of patient-centric care, which is lacking because our system is highly fragmented. Fragmented in the hospital, in the medical education, because there are departments. This does not concern to me because I'm an eye specialist. This does not concern to me because I'm not a diabetes specialist. This does not concern to me because I'm a gynecologist. This does not concern to me because I'm a physician. This is not my domain, I'm an ENT surgeon. So who is the whole person, who provider, who take care of the, whole, in charge of the whole person? After all, we are a unit. And same thing applies with the public health system. We have, 36 national health programs, 36 tables in the Ministry of Health, Family Welfare. And they all are not talking to each other. We talk of horizontal integration and all, but at ground level, practically, the morbidity is not addressed. And again, the system design from primary care to tertiary care, where, under-diagnosis to over-diagnosis thing is happening. This has to be taken care of. And last point I was to make on the behalf of the community that I serve the high-end IT professionals in the suburbs of Delhi. And they are young people. We talk about the vulnerable population of children, women, elderly population, but in my mind, the drivers of the economy, young people, are under health stress. They are working like horses. I went to Australia, everything closes at 6 p.m. in the evening. Our guys, engineers, IT engineers, working 16 hours. Without leaves, they are even afraid to ask for medical leaves from their bosses. And they are eating all type of food from outside. Working women are exposed to alcohol and smoking. Very common nowadays to see women smoking in public places, which was not common in the previous days. I'm not talking about the cultural things. These are the evolution of the, present contemporary corporate environment where our industry needs to think, where one of the giants of industry, Narayan Murthy, says that our workers need to work more. But our workers are the oil, human source of the oil of the world. But we need to talk about and take care of those people also, their health, younger people health, and the workers' health is very, very important. Their lifestyle is very important. Their leisure, rest is very, very important. So thank you very much, Health Parliament and International Patient Union Conference, for inviting a family physician to this conference, to this table, so that I can speak out on behalf of our patient and community, not just on the professional basis. Thank you very much.